My name is Morgan Einison, and I'm the Senior Manager of Education at Fighting Blindness Canada. I'm really excited to be here today, and we're joined by a very special guest. Today we are here doing a Facebook Live to talk about World Optometry Week. So World Optometry Week and Day both shine a spotlight every year on the profession of optometry and the contributions that optometrists are making worldwide to help increase access to eye care and eye health as a human right. And so we are in the middle of World Optometry Week. And I am really excited to be joined today by Dr. Glen, who is a lead optometrist at our friends FYI Doctors. And Dr. Chiasson is here in Toronto, Etobicoke, I guess. And he's joining us on Zoom to talk a little bit about optometry. So thank you so much for joining me.
Thanks for having me. Thanks a lot for having me on. World Optometry Week, pretty exciting for us. And as you said, helping to let folks know what we can bring to the table in terms of eye care and importantly, maintaining good vision for as long as we can, which is something I will be hitting on as we go here.
Awesome. So why don't we start off and can you tell us a little bit about what an optometrist does?
Yeah, so I mean, I think a lot of people have a general idea for eye exams and eye doctor and what have you. So we're part of the healthcare team, and we focus on, pardon the pun, examining you and treating vision disorders and ocular health disease, right? So the main thing people associate with us is the eye exam. Hey, what can you see? Can I help you see better? I'm blurry to see the blackboard. I'm having problems reading. I can't drive at night, etc. So that's the sort of thing that people typically associate with us. And then subsequently prescribing glasses, such as the lovely pair Morgan has on, or contact lenses, which are the invisible pair I have on. And sunglasses and tints and protective eyewear and things like that. Then we're also going to be helping diagnose problems like glaucoma, cataracts, diabetic eye disease, macular degeneration. We also do something called vision therapy. And so my thing that I talk about a lot during the day is vision is clarity and comfort, right? To be really clear, excuse me, but to be uncomfortable all day isn't very fun. So we're trying to work on the two, and sometimes we need to do some eye exercises and different things to help our eyes and our brain communicate better, or help our two eyes communicate better. And then if you do have an issue, eye infection, what have you, then we're going to use some eye medications, topical medications, oral medications, same for glaucoma and things like that. And then I think of myself as just a piece of the team, right? So we're going to then coordinate with your GP if we need to, with an ophthalmologist if we need to, things like that, geneticists sometimes, specialty testing. And then we're all on the same team then trying to manage your eye health, right? One thing I always say is, I'm trying to get you to see as well as you can for as long as you can, right? And so an eye exam in and of itself is just a part of that, arguably a pretty big part, but it's seen as part of the bigger picture. I had a prof who always used to say, eyeballs don't walk in on their own, right? So they're accompanied by the rest of the person, and you need to take all of that into account.
So you're talking a little bit about being part of an overall eye health team. So there are, I think we talk about like the 3 O's. So there's optometrists, ophthalmologists, and opticians. So can you talk a little bit about how your role as an optometrist is similar or different to the other O's?
For sure. So the way the sort of example I always use would be like your family doctor, and a surgeon, and your pharmacist, right? So all part of the team. So let's say you think you have an issue with your heart, just as an example, right? You see your family doctor, they say, oh, we're going to do some tests. They do their tests and they think, oh, I'm going to make an appointment with a cardiologist or what have you. Right. So that's a second part of the team. And then they decide, oh, we're going to put you on some medication. So you go to the pharmacy, and the pharmacist walks you through that process and gives you their advice and that sort of stuff. And that's the third part of the team, right? So to me, the optometrist would be analogous to the family doctor. We're kind of like big picture eye health. And then if we need eye surgery, if you're having, for example, a retinal detachment and you need retina surgery, well, then we're going to send you to a surgeon. So that's the cardiologist in that previous example. And then you may need to get some glasses. Well, that would be the optician part of that scenario. So an optometrist, we do our university degree, and then we go to optometry school, similar like a dentist, for example. An ophthalmologist goes to med school and then does a residency in ophthalmology in terms of where they want to specialize often into. And an optician has an optician course where they learn all about all the optics and glasses and contact lenses and manufacturing, lens centration, and all the optics that I found really difficult when I was going to school. And so we're all working together. It's like a little triangle of O's, and we're all sort of cross referring back and forth. And again, I really like to think of that sort of teamwork picture. So easy example: optometrist, family doctor, ophthalmologist, surgeon, optician, pharmacist. I hope that's clear.
That's a great analogy, actually. I like that. And as someone who's been seeing an optometrist since I was very young, I think the first time I saw an optometrist, I was probably like 7 or 8. That's when I got my first glasses. So it's a great way to get your eyes checked. And we'll talk a little bit more about how important those eye checks are in a bit. So you mentioned a few of the eye conditions that you see. So could you talk a little bit about some of the most common eye conditions that you see in your practice?
Part of the reason I like my job is that if I see 20 patients in a day, there might be 20 different things that I do that day, right? And so that I've been doing this a while now. I like a little bit of variety during the course of the day. But the main one, obviously, that everybody associates with an eye exam is, hey, I have blurry vision, right? I'm nearsighted, I'm farsighted, I have astigmatism or multiples of those. I have what's known as presbyopia. That's what people typically associate with their eye exam, and that's the bulk of our day, certainly. But then there's things like eye infections. Hey, I think I have something in my eye. It feels like I have an eyelash. I was doing something in the shop, and I think I got something in my eye. And so with our microscope or slit lamp, we can go in and magnify that and make it a lot easier to get out of there. So that would be one from this morning, for example. And then a big one nowadays, especially as more and more people are on computers all day, dry eyes, right? So that scratchy, gritty feeling, especially as the day goes on, especially during the winter, when the air gets cold and dry, our eyes just get irritated from that. It's not infected, it's just sore, it's annoying. How do we deal with that? And then, some of the bigger eye disease type things would be things like glaucoma. We play a pretty big role in diagnosing that, because that, glaucoma is something that you don't really necessarily notice until you're well into having glaucoma. And, I tell people all the time, like, I don't want you to notice anything in your eyes, right? Like, we want to get into this before you notice an effect on your day-to-day function, right? So something like that. Cataracts as well, a lot of glare, needing a lot of light to read as we get older. When do we decide to actually have surgery to correct that? A lot of times that's the conversation that we're having. Macular degeneration, a lot of that can be influenced by lifestyle. So that's a conversation that we have, things to avoid, things to do, and ways to sort of slow progression. As you may know, there's a bunch of eye vitamins and things like that, and sort of managing our way through that. My topical practice is in a medical center, so we see a lot of diabetic patients. So we're screening for diabetic retinopathy and management there. And again, deciding when does this warrant maybe laser treatment, maybe some ocular injections via the ophthalmologist. Do we send a note back to your family doctor and maybe they decide to change your medication? Maybe you decide to get back on the treadmill that you've been hanging your clothes on, things like that. So again, that's part of the conversation. And then, eye allergies, those are really common. Those are going to start popping up again in the next month or two. I tell everybody April and October is when that really starts to hit. For me, September, but and in that sort of ballpark. And then obviously, lazy eyes, eye turns, things like that, that sometimes can be improved with vision therapy a lot of times, and may sometimes require referral to an ophthalmologist for surgery. So that's a big part of my day here in Ontario. Each province, each territory has its own regulations and guidelines. So again, that's a pretty big overall picture. And day to day, that's what we do.
Well, I like we said, it's very varied. It sounds like you've got lots of different things on the go. And
Yeah.
as I said, I've been going since I was about 8, and I'm getting to that age now where the single glasses aren't enough. I think I need to get those little readers. I'm resisting the
Your
urge
story is
that
very similar to mine,
I'm
right?
gonna
That
have
was
to
in
get
grade
there.
four. Grade 4, got my first pair of glasses, got contacts in high school. People out there will find it hard to believe, but I'm over 40.
Yeah.
And so I don't read as well. So I wear multifocal contacts so I can see up close and my computer and drive home. And
Yeah,
I also
I
used to
would
have a lot of hair, things change for
same
me.
here. I went to
You
the optometrist recently, and I was convinced there was something wrong with my eyes because, again, working in this field, I know all the things that can go wrong. So I was like,
Yeah,
"There's
yeah.
something wrong." And she's like, "No, you just need progressives." I'm like, "No, no, no, that can't be it. It's
Yeah.
not
No,
just
that's
that
not
I'm
the answer I wanted at
aging.
all.
No, that can't be the answer." Uh,
That's the wrong answer. I'm only 29 years old. I don't need
exactly, and it's
progressives.
sticking.
I'm
So,
with you
yeah. So, important question then: how often should people come to see their optometrist?
for sure. And again, this is obviously big picture answer, right? Like everybody's individual, and your mileage may vary, for example. But easy answer, with kids, you can do your first eye exam in about 6 months. Those are usually pretty big picture. It's just more for me making sure your eyes are relatively aligned. They won't be exactly, but at least roughly. Make sure both eyes are about equal in terms of their vision. That helps your brain use both eyes, right? I think of it like going to the gym and using a barbell to do an exercise or 2 dumbbells. We want our eyes to be like barbells. We want both eyes working as much as possible. And then usually at that point, assuming everything's fine, around age 2 or 3, and then we can start kind of going annually after that. And a lot of times those exams are quick and fun, and it's hard keeping a 2-year-old occupied and still for 5 minutes. So they sit on mom or dad, and we do what we do and get the information we can get. And luckily, a lot of this week without any feedback from the patient necessarily. And I mean, they're not driving at that age. Not a lot of computer use, hopefully. And so it tends to be pretty quick and easy and fun. And then you're going to do annually till you become an adult, let's say. And then for me, it's usually every couple of years. But if you have a family history, if your vision's changing real quick, if you're on a computer a lot, if you wear contact lenses, we may tighten that up maybe to annually just to watch. Luckily nowadays the contact lenses are really good. And luckily for me, I don't see a ton of contact lens complications anymore on a regular basis, which is awesome, right? I mean, that's the whole point, is to see a patient once and hopefully not again for another year or two, because that means everything's great. And then, for example, if you have if you're diabetic and we see a little bit of diabetic eye disease, maybe we do every 6 months instead of every year, or maybe every 3 months if it's right, and things like that to monitor for certain things. But the main thing I tell people, and I try to say it at the end of every eye exam, if you notice any change, from sit on it. Don't know. He told me to come back in a year. Um, Today's your new baseline. Any deviations from today probably should get checked.
Yeah, I think that's if one takeaway from today out there, that's the one, right? That you have to sort of monitor your own vision, and if something doesn't feel right, it's time to go in and get that checked up.
Yeah,
Better,
like I tell
earlier the
people a
better.
lot, like I don't want to feel my liver. I don't want to feel my shoulder, right? Like
Right.
they should just be doing their job. As
Yeah,
soon as I become aware of something, something's up, and I should probably get that checked.
absolutely.
Easy way to think about it.
So speaking of these yearly checkups, so can you walk us through sort of what would happen for a yearly checkup? What are you looking at? What sort of tests happen at that
Yeah,
yearly?
for sure. Yeah, I mean, I had a patient this morning where we checked his vision, and he got up and he was like, "Well, thanks." And I'm like, "Whoa, whoa, whoa! That was only the first part. There's more, right?" And so, I guess if we were to walk through an exam, for example, right, we're going to go through your history. Why are you here today? Are your eyes bugging you? Are your glasses okay? Can you still see? Your medication, your family history, your medical history, your ocular history. Have you had laser vision correction? Have you had, what have you, right? And then once we're done all that part, then we sort of jump in and we check your vision. We check your vision with your current glasses. We check your vision without your glasses to see, where we're at and how we are compared to baseline. Then we'll sometimes also check your eye movement, make sure everything's pointing straight ahead when we want it to, and things like that. And then we do what most people associate with the eye exam, which is the which is better, one or two, right? So we'll do one eye, we'll do your other eye, we'll put them together, we'll check for reading, we'll do all these things to try to get as accurate a prescription as we can get for you there. We may also recheck some of your eye movement and eye alignment. Especially if there's been a big change in your prescription, things like that we think there might be some issues there. And so that to me is sort of part A, and that's where that gentleman today tried to escape. And I made sure he didn't, because then we go to part B, right? And so part B is checking your ocular health. So we do what's known as a slit lamp. That's that microscope thing. You have your head in the little holder, and we kind of sweep across your eyes with that little beam of light. So we're looking at the front of your eyes, we're looking at your lids, we're looking at your eyelashes, we're looking at the whites of your eyes, and we're looking at your iris, and we're looking at your and all of that stuff. And then we'll likely check your eye pressure. Elevated pressure. The only way to know it's high is we check it and we discover it's high. Then we will often do the part that everybody really loves, which is the dilating drop. So we put the drop in. You will be blurry for reading for several hours, according to some patients, several weeks potentially, but realistically, a couple of hours. And that to me is like opening the curtains, right? Like we want to open up so we can look in that window to get a really good look at what's going on in the back of your eye, especially if there's any concern about your retinas or retinal tears, retinal attachments, so your flashes and floaters type of ideas. And then we may also do some pictures of the inside of your eyeballs for baseline or for monitoring different conditions. We can do an OCT, which measures thicknesses of structures in the eye. Check your color vision, peripheral vision, all these different things. And then we have parts when we sit and we review all of that information. We have time for questions. What step here? Hey, do you think I need new glasses? And sometimes that answer is no. You see fine. You're happy. Your prescription didn't change much. Are you fine with the ones you have? And do that. And then at that point, then we will plan your next appointment, either a year or 2, 6 months, whatever that ends up being. And then you can go and select new eyewear if need be. You can order your contacts. You can chat with the reception team up at the front. They're great. And then what you do after that is sort of up to you. But that's
And how
your
long
basic eye exam.
how long would you say that roughly takes, that process?
From when you walk in the door to when you leave, depending, probably 30, 45 minutes. It's not sort of just looking the little things, click, click, one or two, hey, we're done. And sometimes it is. Like if you're just having an issue with your glasses and I saw you 2 weeks ago, yeah, we're probably not going to do that. A full eye exam again, we might, but your full eye exam, there's a lot going on there. And I usually tell folks, probably 30 to 45 minutes, because especially if we put the drops in, those take sometimes 10, 15 minutes just on their own.
Perfect. I lost you there for a sec, but I think we're back.
Yeah, we both, I think, froze at the same moment. I was like, oh,
we had
this
tandem
isn't good.
freezing. Yeah, so to me that seems like, 35 to 40 minutes once a year to maintain your eye health. Sounds like a pretty reasonable amount of time to me to go in and check.
Yeah, I mean, I don't like throwing my wife under the bus, but she spends more time than that on things, right?
I'll
I mean, I
just
don't know what
admit my Instagram time is probably that every
right?
day.
But I mean, I don't even know what's involved in a mani pedi, but it seems to take a while, right?
There you go. Exactly.
Right. And so, you know, getting your eyes checked, like you said, once or every year or two, that's pretty good investment of time, I would argue.
For sure. So I want to give our audience on Facebook, because we are live on Facebook right now, any
Sure.
opportunities to ask their questions. So I'll throw that out there that you can throw a question in the comment box if you have one. While I wait to see if anyone has any questions, I have a question that we often get through sort of our health information line at Fighting Blindness Canada, or when I'm talking to people at our events. Some of them, a lot of the people who we meet and work with, they have eye conditions that are inherited retinal diseases. So often they're diagnosed young and they know that their vision is going to sort of progressively get worse over their life. And they're like, well, I know what my vision is. I know what's happening. I don't need to see an optometrist. Like, it's fine. So I always am like, well, so can you talk a little bit about that? So if someone has something like that, they've been diagnosed, they're otherwise their eyes seems healthy, how often should they be coming in for a checkup?
I mean, I still think a pretty routine schedule is probably pretty useful. At that point, they may be seeing an ophthalmologist in between. So then we can sort of push that back out a little bit. So I have some patients that I know are getting their eyes checked on a pretty regular basis, and we may push that out to every 2 years. But for me, it's a lot about maximizing what we have, right? And so if we can make things that little bit easier, sometimes that's worth it, right? And so in Etobicoke, I'm lucky. A former schoolmate of mine is what's known as a low vision specialist. So she deals with patients with vision loss and aids for them. So magnifiers, closed circuit TVs. She has these, like, sort of the forerunner of the Apple glasses and Google glasses with magnifiers and sort of almost like overlays of things that are great. And it's hard to do in a primary care practice, but I'm luckily for the few patients that I have that need her services, she's pretty close. And so I'm really really quick to take advantage of that and that resource, to get people as much vision as they can get. Hey, I want to see my bank statement. I found an old box of photos of my grandkids when they were little. I'd like to make them bigger so I can see them. Day-to-day things that people need to do that we can try to make easier, right? Another thing is, sometimes, I was talking with a retina specialist maybe a month or two ago, and they're running a bunch of clinical trials. So maybe this patient would qualify for something like that. And if it's been a while since they were in to see a retinal specialist or what have you, maybe that's something we could look at doing, and updates on that. And a lot of it is, again, that teamwork idea, right? Is we're all on the same team. How can I help your ophthalmologist manage what you're doing better if I can? Are there some changes maybe that have happened? If you have some inherited conditions, other things may happen, right? You may still get cataracts. If you're lucky enough to live long enough, you'll get a cataract, right? So that's something we can help with, and it's that sort of thing. And a lot of it is, again, reinforcing that teamwork idea. We're all in this together, right? Like, my job is to try to keep you seeing well for as long as we can, and I'm a part of the team that's going to be doing that with the opticians, with the ophthalmologist, with your family doctor, et cetera, et cetera, et cetera. And so if I can help in the least little bit, just by touching that base every year or two, I think there's something we can add to the mix there.
Absolutely. And that's what I tell people when they say that. I'm like, well, just because you have one eye disease doesn't mean you're immune from glaucoma, from AMD,
Right.
cataracts, and, identifying those things early so that you can maximize the vision you have, I think is really a
Exactly.
worthwhile reason to go. We have a question here on Facebook. Someone's asking, they said they've been seeing floaters recently, multicolored. Should they be worried?
There's a lot to unpack there. Floaters, yes. Now, if they're more like flashy lights, is that a floater? Is that a flash? I don't know. Is it an ocular migraine sort of variant where some people get these visual auras with jaggedy lights and things? But my general rule of thumb, and I did this myself one day. I was driving to work and I was like, hey, my contact lens is dirty. And I got to work and I changed my contact lens. And it was not my contact lens. It was a floater. So I got my eye checked later that day. I went and saw a friend of mine who was open later than I was. And he took a look. Luckily, it was just a floater. But my rule of thumb is within 24 to 48 hours, new floaters should be checked, especially if you see flashing lights associated with that, typically out in the peripheral part of your vision. Or obviously a change in vision or change in your peripheral vision. And then a lot of this comes down to when did this start? If it's been there for 5 years and it hasn't really changed, well, yeah, you can probably wait an extra day or two. But a new onset of floaters, I am not likely to sit on that. We will we try to get patients in that day if they can. If they call us and they have floaters, we're going to try to figure out what exactly is doing that as quick as we can.
So yeah, absolutely. Thank you. So the last question, I think, kind of related to that. So we've talked about the floaters, but are there other signs or symptoms that people should be aware of in between their eye exam if they're having that it might be cause for concern?
Yeah, I mean, the big one, as we sort of discussed, is like anything different, right? Like anything where you're like, this seems weird, right? And I tell people, I'm like, it's way easier for me to tell you what, like, I can give you a list of things you should watch for, or you can just umbrella statement. If it seems weird and different than it is right now, go get that checked, right? But obviously, changes in your vision, flashes and floaters, as we talked about, red eye, sore eye, a lot of discharge, that sort of thing. I would say, yeah, that should be relatively urgent, right? Eye strain, eye fatigue, new headaches, family history. Hey, my mom just got her eyes checked and she was told she has glaucoma. I want to come in and get that checked. That sort of stuff. Again, for sure, within a few days, a week, 2, whatever, depending on onset and duration there. Obviously, an issue with your contact lenses should definitely be checked relatively quickly. And some medications. Your family doctor or specialist will often say, hey, go get your eyes checked just to be safe, because there are potentially some complications that can show up in your eyes. But for me, the big thing is always in terms of should I be seen soon, changes from normal. That to me is always the big thing. And that varies for everybody. But, we're pretty good at knowing what our vision's like right now. If it's different than that, that's a sign something might be up. You should go get it checked.
Absolutely. Well, we are all out of time. So thank you so much for joining us, Glenn, and sharing all of this great information. This is everyone's reminder out there to book your yearly eye exam. And happy World Optometry Week.
Yeah, just don't book between now and the end of the week.
Yeah.
It doesn't have to be this week,
There's going to
but
be an
soon,
onslaught. You're going to
right?
get lots of calls
But yeah,
today.
Morgan, always fun talking to you. Thanks so much for having me on. And thank you for FBC for recognizing World Optometry Week and giving us a platform to let people know what we do all day. So I appreciate that, as does FYI.
Awesome. Have a great day, everyone. Thank you so much for joining us.
Thanks for joining us, everybody.